Hello friends and patients. In today's episode, we'll help you locate your stage of baldness on the International Norwood scale and suggest medical hair loss treatments for every stage for reversing baldness stage-wise backwards. We will not go into the science and mechanism of male pattern baldness in this video. We've discussed all these in our previous episodes. Before we start, make sure you've subscribed to this channel along with the bell button. Let's get started. Baldness is staged commonly using the International Norwood scale. The hair loss stages are described with a number ranging from 1 to 7, depending on the severity of hair loss. Let's start with Norwood Stage 1. This type describes the least amount of hair loss, with an adolescent type of hairline. You can consider this normal unless you have a family history of male pattern baldness. If you have a family history, closely monitor your hairline to determine if your hair loss develops into Stage 2. And no treatment is necessary at Stage 1. Norwood Stage 2. This stage means a small amount of hair loss with progression to the adult type of hairline. Here there's a slight recession of hairline around the sides or temples. Regarding treatment for this stage, if you have family history, first consult a doctor to verify that your hair loss is caused by male pattern baldness. There's a good chance that with treatment, you can regain most of your lost hair and prevent progression into Stage 3. You can start with a simple treatment like 2% topical minoxidil application at this stage, or start rolling a 0.5mm derma roller once a week with or without minoxidil solution. You can check out my detailed derma roller episode from a link in description. Norwood Stage 3. This stage describes a mild to moderate amount of hair loss. This is the earliest stage of hair loss, considered cosmetically significant enough to be called baldness, according to the Norwood scale. At this stage, most men show a deep, bilaterally symmetrical recession of hairline at the temples, that is sides, which are either completely void of hair or only sparsely covered with hair. This resembles letter M, U, or V shape. The vertex figure here shows the additional thinning of the hair at the crown of the head. This is the most important stage of Norwood, because you must start treatment as early as possible to prevent progression into Stage 3. Remember, the higher the stage, the more difficult the treatment is. Well, the treatment options at this stage, you may require a combination therapy like minoxidil 5% twice daily plus finasteride 1mg tablet. This stage is stubborn for most people. If you're able to control or grow back hair at this stage, the baldness progression is generally slowed down in later part of your life. Also, the other treatment options you can consider at this stage are PRP and mesotherapy, along with minoxidil. You can watch my detailed episode on this PRP mesotherapy from related videos on hair loss linked in the description below. You can also consider hair transplantation treatment at any stage from Stage 3 onward. Norwood Stage 4. This stage describes a moderate amount of hair loss. At this stage there is further deepening and recession at the front of the head as well as the temple areas. Hair loss at the crown is also prominent now, and a thick bridge of hair will separate hair loss at the front of the scalp from that at the vertex or the crown of the head. To differentiate this from Stage 3, you can draw an imaginary vertical line tangential to the front margin of the ear. If hair loss crosses behind this line, then this is Stage 4. Regarding the treatment options at this stage, there's no guarantee that using all the treatments including finasteride, minoxidil, or a combination therapy will bring back all your lost hair. But the good news is, if you start early treatment, the miniaturized hair will come back to normal and you can switch back to Stage 3. You might have to use minoxidil in a higher concentration, like 10% plus finasteride 1mg daily indefinitely. Please watch my episode on DHT to understand this miniaturization and the mechanism of hair loss. You can also treat this stage with PRP and mesotherapy plus stem cell therapy and consider hair transplant option at this stage too. Norwood Stage 5. This stage marks the beginning of severe degree hair loss. In this stage, there remains only a thin separation between the loss of hair at the hairline and the loss of hair at the crown. The band of hair between the two is much thinner and narrower. Hair loss at both the crown and the temporal regions are larger and more distinct. The treatment options at this stage are the same as that in Stage 4. Norwood Stage 6. In this stage there's a large amount of hair loss. The bridge of hair that once separated the front of the head from the crown is now almost fully lost. Only a few sparse strands may remain. The remaining hair now forms a horseshoe shape around the baldness, concentrated in the center of the scalp. Hair loss on the sides of the head will also extend further at this stage. At this level, a hair transplant may be the only option. Norwood Stage 7, the most advanced stage of hair loss. Here, only a wreath of thin hair remains on the sides and back of the scalp. This stage has the least chance of regaining your hair with any treatment. So there you have it, folks. Please like, share, and comment below with your feedback. Consider subscribing if you're new to this channel. Stay healthy.